feel like the whole room, there was not a dry eye in there.
It's actually really funny. I discovered you because of a LinkedIn post that you made using Taylor Swift puns.
And so it's not really a full interpretation of your thoughts, and there's not really a way to write new thoughts into your brain.
You said if you're amputated, you can feel your amputated limb. How exactly does that work?
Yeah, that's a really good question. And
The concept of someone being able to like manipulate and control a computer just from their mind is absolutely insane.
we're getting less scared of technology because we're so familiar with it.
Okay, so I'd like to welcome Dr. Ashley Dalrymple to our podcast. It's actually really funny. I discovered you because of a LinkedIn post that you made using Taylor Swift puns about like the ethics of technology, like neural devices and stuff. Yeah, I just wanted to ask you as like an icebreaker question, what has been inspiring you lately? Could be something personal, just a book, anything like that.
Yeah, I recently found myself really inspired by a panel at a conference that I was at where one of the panelists was a person who received an implant in their brain that helped with their depression. And that's not an area that I normally work in. And I know that doing a lot of the technology that we develop, it's only more recently being used in people with different psychiatric disorders. But hearing his firsthand experience about what his state of mind was before he got a deep brain stimulator implant and then after, and just how that has transformed his life. I feel like the whole room, there was not a dry eye in there. It was really powerful and really inspiring.
Yeah, that's actually
Yeah.
so interesting. I definitely was not aware that these kind of things like existed and were in use at all. I guess for someone who has no clue about brain-computer interfaces and stuff like that, what exactly are there, like in a very simple way?
I would say in the scientific community, there's maybe a bit of debate on exactly what it is, what is and isn't a brain computer interface, but really what it is it's a way for us to communicate with the brain, and we do that using electronics. And so the brain itself, it has neurons, and these neurons communicate with electricity, and if we put a wire near those neurons, we can record that electricity. And if we put those wires, or electrodes as we call them, in a certain area, say an area that normally controls your hand, then we can record your brain activity that is firing because you're trying to think of moving your hand, but maybe someone who is unable to move their hand. So in a way, you can record activity from the brain as it's trying to do something, and then you have to interpret that in a way that makes sense. And so, aside from just the electronic side where you record these electronic signals of these neurons, and sometimes it can be an individual neuron or even a group of them, and so different techniques record it in different ways. But you also have to do what we call decoding, and it's really transforming that electrical activity into something that's useful. And that also requires training. Usually, the people have to focus on a task a lot, and then the computer side of it is trying to interpret this electrical activity into something that's useful. And so it's an interface or an interaction between a person and a computer with this implant, or even an external device, of just trying to uh, understand what the brain is trying to do and then turning that into something that's useful. And then on the flip side, you can also stimulate. So that means delivering electricity to the brain, in an area that maybe is not functioning the way that you want it to. And right now, it's pretty limited to literally electrical stimulation, where we have wires or electrodes with some electrical current. But there's a lot of new development in using something that we call optogenetics, which is using light to stimulate neurons, or even ultrasound, like a mechanical type wave, or even magnetic stimulation. So there's a lot of things out of the pipeline right now, but at its heart, the brain has electrical activity, and we try to record from it or deliver more electrical activity.
That's really interesting. Yeah. So like you mentioned earlier, like at that talk, you were hearing this person's experience and stuff, and you said that you didn't really work like in that side of it. So like which part of this whole process do you exactly work with?
I work more on the what we call motor control side, and a lot of my work hasn't necessarily been in the brain. It's been more in the spinal cord, which is another part of the nervous system that connects. It's on the way from the brain to the muscles. But it has a lot of neurons in there that do a lot of different things. It's more than just a cable that connects the brain to the muscles. And so there's interfaces that we can develop that communicate with the spinal cord and help people restore movement. So you can actually take a limb that's paralyzed, and if you stimulate the spinal cord, you can make the muscles in the limb move. We've also been using it to make people feel their limb after it's amputated. And so the spinal cord also has a lot of the sensory neurons from the body. When you have touch or pressure, those nerves go into your spinal cord and then they go up to your brain. And so if we stimulate it as it's coming into the spinal cord, we can make people, say, with a missing limb, make them feel their missing limb again by stimulating the spinal cord. And so I like to look at how that actually impacts their ability to then also make movement. So it all kind of comes back to helping people move better is more of my area.
Hmm. That's really interesting. So like the implants that go into the spine and stuff like that to restore movements, and you said if you're amputated, you can feel your amputated limb. How exactly does that work? Like, is it an external device?
Yeah, that's a really good question. And a lot of it I would say like this was on the research side, so this isn't approved for that purpose. But those implants, so we do both implants and non-invasive types of interfaces. And the implants are approved for pain treatment actually. And so the devices that we implant into, over the spinal cord, they're available and they've been available for decades to help people with chronic and neuropathic pain. And they're used quite a bit in people with low back pain. And they found over the years that it can actually make muscles move, right? And so over time in research, it became a technique where if you pair it with rehab, so as people are training and doing their exercises, if you're stimulating their spinal cord at the same time, it boosts their rehab and then they can have a better recovery of walking. And that's kind of how that part of that field kind of shifted towards that area. And then for the sensory part, we also know that if we stimulate the spinal cord as a side effect, people feel tingling sensations and prickling electronic sensations in the areas that are innervated or connect to that part of the spinal cord that is being stimulated. And so we also thought, well, most of the time we don't want this little tingling sensation because people already have sensation, so it's more distracting than something that's desired. But if someone doesn't have a limb, then maybe that becomes useful because then we're kind of making their brain think that that limb is actually still there. And if we give them feedback or a sense of touch, that even if it's artificial, their brain will interpret that as something useful. And so, say if they're walking and we stimulate their spinal cord when their prosthetic limb touches the ground, then they are getting this feeling that that foot is still there and that it's touching the ground. And then they become more stable when they're walking, especially with more difficult walking tasks. And so a lot of that's done kind of repurposing those pain stimulation devices for different areas. And there's a lot of work on trying to get those same devices FDA approved for these new applications. So that's kind of the fastest pipeline to get approval as well, is using something that's already approved and using it for a different application. But we've also started working with non-invasive devices. And so there's a newer technique that is just using stick-on adhesive electrodes that we place on the back. And if you stimulate, you can kind of reach with the electrical field down deep enough to the same areas of the spinal cord you would if you had an implant. And the nice thing about that is a lot of people don't want or aren't eligible for an implant. And so it kind of opens up a new tool that we can use maybe in a similar way that's a little bit more accessible to a larger group.
Wow, okay. So there are like a lot of applications for this actually. Talking like specifically about some of the projects that you've worked on, I have here like the Stentrode or the Injectrode. Like how exactly does it interact with the brain if it's an implant versus not an implant, stuff like that?
Mm-hmm. Yeah, those two are made to be implants, but the maybe I'll start with the Injectrode. That was one that I had worked with when I was during my training, and the Injectrode, it's a fun name. It means injectable electrode, and the idea is that it's getting away from those stiff metal wires and metal electrodes that we typically use, and trying to get a material that's a little bit more soft so that it conforms to tissue better, And then it's maybe accepted by the body a little bit better. Because when we do implants, there is always a challenge of the body's immune response to this foreign body and dealing with rejection. And so to try to make these implants last longer, there's a lot of different things that we try to do, and one of them is reducing stiffness. And so the Injectrode was targeting that, and it was developed as a method for treating pain similar to spinal cord stimulation. There's a structure kind of just off the spinal cord. When I was saying we have our sensory nerves that are coming from our periphery or our hands or our feet, and they come up into the spinal cord. Before they come in there, there's a grouping of their cell bodies, and it's called a ganglion. So it's like a little ganglion of their cell bodies, and the name of it is a dorsal ganglion, but that's not important. But what is important is if you put electrodes there, they actually can also have really good pain relief, and it's really good for people who have phantom limb pain, so pain after they're missing a limb, or with pelvic pain. And it's a newer technique, but it's a little bit challenging to do surgically because a lot of the implants, they will guide it with a needle, kind of like an epidural that they use for drug delivery, but they use it to feed these electrodes over the spinal cord, and then they have to steer them kind of back out. And so it's a little bit challenging. And we were trying to think of a way of not needing that whole process and instead have something that can come in and you can just inject over top of this group of cell bodies, and then have a wire or something that comes a little bit more external. So it's a little bit of a mix of invasive and non-invasive, where we can access it externally with a very minimal implant procedure. And so we were trying to compare it to kind of the gold standard right now for our normal stiff electrodes. And so that was the work that we did, and that's led by a company called Neuron, and they're trying to move towards human studies and have done a little bit of safety testing in that realm. But it's really just trying to make something that can help people with their pain, because pain is a huge problem worldwide, and the more people we can get off pain medications, the better. Um, and then the Stentrode, that's managed by a company called Synchron. The inventors are actually out of Australia, and they're in New York now. And I was fortunate enough to come on early on with their early feasibility study clinical trials when I was in Pittsburgh, and we had some multi-site trials that were going on. And the Stentrode to me is one of the coolest pieces of technology in existence. It's one of my favorite interfaces because I think it's just so different from all the others. A lot of people may have heard of a stent that is used medically. So they're used a lot with heart procedures. So they put a stent to open up different blood vessels, and they also put them in the brain if there's blockages in the blood vessels in the brain. So they feed these kind of net stents that expand, and then they open up that blood vessel, and so they stop people from having heart attacks and strokes. And this group of researchers, they thought, well, if we're putting these metal net expanders in the brain already, why can't we put maybe an electrode contact on them and then record from the brain while we're there anyway? And so that's kind of how that started. And so they manufactured modified these stents to have these little circular electrical contacts on them. And it's really nice in that you don't need to open the brain and the skull and expose everything and try to implant stuff in the brain to record from it. Instead, they go through a blood vessel and they feed this stent up as they would normally, and they expand it and they put it in a blood vessel right at the middle, at the top of your brain. And it's really close to the part of your brain that controls your foot. And so in these people, you can get them to imagine, moving their foot back and forth as if they're driving. And that can be recorded from this Stentrode as a movement. And they've been using it to control cursors on a computer screen and for clicking. And it's taken people who have ALS or a severe spinal cord injury or a very severe stroke, and now giving them the ability to control a computer just by thinking about moving their ankles. And for people who are, especially if they're really severe and they're locked in, that can be life-changing, because now instead of relying on an eye tracker that can be really tiring, or linking with someone with a yes, no, or letter board, now they're able to have their intentions a little bit more used and interpreted by a computer, and now they can send emails or shop on Amazon or get a Netflix movie started or something like that. And so I was in some of the early part of that study and worked with one participant before he passed. But seeing how that has grown, I'm so excited for where that's going because I think it's going to be such a game changer for people who have very severe paralysis, and it's a little bit less scary, and also more physicians will be more used to that procedure already. So I think for actually moving it forward into something that can be more widely used, it has a really good chance of making it through that approval process and that uptake process.
Yeah, for sure.
Yeah.
I mean, the concept of someone being able to like manipulate and control a computer just from their mind is absolutely insane. And I think the first time I ever heard of that was with Neuralink, or
Mhm.
like is that different from the Stentrode?
Yeah,
Stentrode.
they're different in that the technology that they're using is different, but they're all really going towards the same goal in a lot of ways, right? Neuralink, they also have really cool hardware technology. I mean, think even colloquially, it's called the sewing machine, and that was my first thought. It takes these really, really, really fine wires that are, a third or a fifth of the size of a human hair, and they take this almost like sewing machine and they put these little wires through your brain. And so, in that way, you do need to open the skull and you put those in there. But the wires are so fine that makes them softer so that the body doesn't have as big of an immune reaction to it. But really, they're doing a lot of the same things where they put it in the area that you would think, like when you think about moving, it's recording those from those same neurons. And so they're also giving people back the ability to use a computer and move a cursor across a screen. And that opens up a lot of doors again for people being able to have a little bit more autonomy in their lives, better for communication. Sometimes these devices are used to control wheelchairs, so it can help them move around, things like that. And so they're really all moving towards a lot of the same goals. I think it just depends on, sometimes there's a little bit on what the public sees from whoever is representing these companies, but the engineers and the physicians working for them, I think, have a very good handle on what it actually takes to do those things and know the realities of the limitations and capabilities of these devices. And I know there's, a lot of talk of, reading a mind or different kind of vision stuff, and there's a lot of different applications of these, but I think what's important is that at the heart of it, you just have electrical signals in your brain that we're trying to record. And so it's not really a full interpretation of your thoughts, and there's not really a way to write new thoughts into your brain. And so I think, as much as I'm excited about all these different companies coming into this space and getting a lot of people excited about them, I think there's easy ways to get fear mongering out of hand and
Mm.
misinformation out of hand. And so at least I know the people on the ground doing the work know better, but I think we need to do a better job communicating it.
Yeah, for sure. What you said about fear-mongering, completely true. I feel like as much as there are like positive things about this technology, like we've listed all and we've gone into like every single probably possibility that you can apply this, I feel like there are definitely some concerns and like a lot of fear against like devices in your brain. I guess, have you ever seen these kind of concerns expressed to you and like what are they generally?
Yeah, something interesting about working in this field is that if you have anything that becomes a little bit more known publicly, like my Taylor Swift themed paper, it does mean you get messages from people who are maybe not well. And so sometimes a lot of people, and I think it's even more so in people who actually do brain-computer interface work. I think I get less of it because I work mostly in the spinal cord, but you do get messages from people saying, help me, I have this implant in my brain, the government is controlling me. So you do get, I think on that extreme end, you do get messages like that. Or oftentimes there's comments on the social media thread saying, like, no way, no one's putting anything in my brain. And I think it's mostly people thinking that by doing that, that we are somehow puppets of a marionette controlling someone's mind and their thoughts and changing their intentions. And that's really not the capabilities of these devices. And I don't think that it ever will be. I think as much as we can say how these technologies help people, at its heart, you're just recording electrical activity of some neurons. And so really it's taking what people are thinking and putting it into something useful, but it's not as straightforward or even as complicated as trying to like read thoughts, right? It's more of you have to get used to thinking about moving your ankle over and over again. And then that turns into a computer cursor moving, right? And so as much as we can decode these in different ways, and there's a lot of really good use in say like trying to figure out how people are speaking, like a speech neuroprosthesis is what we call it. It's a lot of training to that person, but it is in no way substituting their thoughts or their autonomy. And I think, there's a lot of sci-fi that has built up over the decades, and just a lot of just misunderstanding. And I think that's kind of something that we're always battling in a lot of these advanced technology and health fields is there's just misinformation everywhere. There's misunderstanding. There's people who are overselling what these devices are capable of doing. And then there's people that just have a completely wrong idea about how the brain works and how these technologies work. And it's not necessarily their fault for not knowing that because it's not something that is common. It's a very niche area. And so I think we just need, as a whole, to do better communicating about what these devices are truly capable of and dampening a little bit of some of those fear mongering. Because honestly, as much as they're advanced, they're maybe more rudimentary than some people might think.
hmm Yeah, what you said about sci-fi movies for sure. I've seen so many like dystopian novels, movies, and stuff like that. They're exactly about these kinds of things, but like on a completely different level. So yeah, I think it's really is just about awareness of what exactly is this technology capable of, and like the general goal of people. It's not like malintent people are trying to invent these things, you know? But yeah, so like I guess one other concern, like other than oh, like reading someone's mind is like a privacy concern or whatever, it's just like autonomy, like your own autonomy of like you said, like moving your foot and like being able to or thinking of moving your foot and trying to control something. I feel like there's like issues around that where I don't know, I guess it's like difficult to understand how much control you have like over your own self, like just from having thoughts. So yeah,
Mm-hmm.
like what do you think of that?
Yeah, it's an interesting question because I think what everyone making these devices is trying to do is give back more autonomy, right? And so it's not a way of trying to take that over or overwrite it. It's a way to try to give it back. And anytime you have an interface between a person and the nervous system, and they're controlling a computer or an artificial limb or a wheelchair, you're trying to give them more autonomy over their own body and their own mind by giving them abilities that they may have lost because of an injury or a disease or a disorder. And so we're also trying to like reduce the burden as well, right? And so if we have someone who's reliant on a letterboard for communicating, and that always requires at least another person and another person who can maybe quickly get what they're trying to get at. And if we can change that by giving them a device that will read a little bit of their ankle movement and they can do that quicker with the computer, that's returning a lot of autonomy to them as well as the person who would be trying to use the letterboard to communicate with them. So I guess when people are using a device to control like a computer cursor or their limb, they have some interaction with it and it's a learning process on the computer and whatever algorithm is used to interpret these brain signals, but the person learns just as much. And so that kind of co-learning process is a good way to incorporate that autonomy. And the people I've met that use a lot of these devices, they take a lot of ownership over what they're thinking and how that becomes a movement of a computer cursor or a wheelchair or something else. And so in that way, I feel like the users don't feel like they're losing autonomy. I feel like they are gaining autonomy and in a way also incorporate that as a part of their own body. And there's a lot of discussion over how do we make things so seamless for people that it becomes incorporated as a part of what they consider as a part of their body. And so the hope is that the more they use these devices, the more they learn how to use it, the more it learns to them, and it becomes one with them.
Yeah, I definitely think that's what should happen. Like, it should feel like an extension of yourself if you're someone using. And I think it's interesting also that you've had like real experiences with like patients who use these devices too, because like obviously from my end, I've only looked at stuff on the internet and seen like, oh, a monkey with a brain implant can like control a computer and like all these crazy things. But yeah, it's really just about the people who you're serving and stuff like that.
Hmm.
But
Yeah.
yeah, like
Oh,
oh yeah, what were you gonna say?
if I can maybe just add quick too, because
Yeah.
I think something that surprised me a lot when I learned or worked more with people towards the brain-computer interface or worked in labs with a lot more researchers in that area, something that isn't often talked about in definitely not in scientific papers, but is becoming a little bit more widely known, is that as much as scientists and engineers, we develop these technologies to help people use a computer or move a wheelchair, move a prosthetic limb, the people themselves, they all have their own goals and reasons for getting these implants and their own activities that they want to do with them. And so something that surprised me was that a lot of the participants that had these implants that came to the lab, half the time they were coming in to just play games and not do experiments. And so it was a way of them to socialize with other people because now they could use their brain computer interface to control not even just, like a Pong paddle, but more complex games and controlling their character. There was also a participant that makes drawings using his brain computer interface, and then he sells those drawings online. We had a participant who really wanted to get back to video editing. So he was a videographer before he developed ALS. And so the people who work in the space also really try to tailor the applications of these brain computer interfaces to the individual person so that their hobbies and their love of different activities can be met aside from just the day-to-day business side of things and communication. There's so much more to it. And so that's something that I also find inspiring and something that I didn't know about when I entered more into that area of research.
Wow, yeah, that's absolutely like amazing to hear. Like, I think a lot of the times like we focus on what's absolutely like the bare minimum, what's necessary. But yeah, like they're hu like everyone's a human. They just want to have fun and like enjoy things.
Mm-hmm.
But yeah, like just kind of as final thoughts, like where do you see this kind of stuff going into in the future and like over the next few years, like developing into something new or just staying the same?
Yeah, I think this area is moving really quickly, and I think it's exciting. With a lot of the new companies, like Neuralink, it's gotten a lot of publicity, but there's a lot of other companies that are in the same space and have been for a while, but they're all now getting a big influx of momentum financially and from the public, and hopefully more towards regulatory approvals. And honestly, I think the public hype is good in that it gets people excited, it gets more money into it. It's a field that's been around a long time but moving slowly. But now there's this huge energy injected into it and people are excited. There's younger people that are, getting a little bit more willing to get these implants. We're getting less scared of technology because we're so familiar with it. And so I see this whole field as moving really rapidly. As there's maybe a limited number of people who are eligible for these implants. Typically, they're done in people who have very extreme paralysis, but I do foresee some people with some paralysis, but maybe not not completely paralyzed. They might be willing to get these implants as well if they make certain parts of their lives easier and more autonomous. And so I think in the next 5 to 10 years, we're going to see a lot more of these getting towards FDA approval and implanted into people. Right now, there's a lot of clinical trials, but devices, I think like, Synchron's Stentrode, because people already put stents in all the time, I think that one has a really good chance of getting a lot of good uptick in implementation because the surgeons themselves need training on how to implant these devices. And so if they're using technology that they're used to using already in their practice, then it makes that step easier. Things like Neuralink or even the Utah electrode array, which right now is the most commonly implanted brain computer interface and the first one to be implanted in humans. Those devices, they do require maybe a little bit of specific training or a specific device to help them put the implants in. But I think the more that the patients demand it, the more the surgeons are going to have to take on those skills. And yeah, I'm really excited. I think that they're going to be used a lot more. I also think that a lot of the way we decode these signals, the electrical signals, is going to get more advanced, and maybe we can record from more than one area or several areas, and we can interpret a little bit more rather than just an ankle movement. Maybe we can get into whole limbs, things like that. And even on the stimulation side, which we hadn't talked about too much, but stimulating the brain can also make people feel parts of their body as well. And we know that touch is really meaningful for making a movement, but touch also has a lot of meaning from an emotional side. If you think of, holding someone's hand or a hug, or feeling something warm and comforting or soft, like petting a cat or a dog, right? There's a lot of emotional attachment to sensation. And so the more we can understand how these devices work and how to read and write from them, and from these electrical signals in the brain, and the more that we can get them accepted by the body, the more we can kind of close that whole loop and give people sensation, but also help them get the ability to move certain things.
Yeah, I mean that's wonderful. Like that's just a positive way to look at things because I think a lot of time if you look on the internet like at what people's perspective is, there's a lot of like you said, just people flooding comments of just negative outlook on this kind of like potential. So, yeah, I mean, it's absolutely insane to hear that like things like this are being developed by people like you. And yeah, thank you so much for being on the podcast and like telling everyone about all of this. Um,
Yeah, thank you for
yeah,
having me. I
thank
will
you.
say from the start when I said, there was that panel with that participant that, or the person that had a brain implant for his depression. I think more of those stories, as much as they're anecdotes, I think they're inspiring for many. And I think the more we share openly these people who have these implants and people get to know them and see how it's transformed their lives, I think people will be a little bit less scared of them. Not
Yes,
to say that it's perfect and it's a solution for everybody, but I think that there's a lot we can do to communicate that better as well. And I hope that the more people that have it, the more they can share their experiences.
for sure. Yeah, I'd love to hear more stories like that too.
Mhm.
Yeah, that's such a great note to end this episode. I'm